Hello, my name is Dr. Maz. I'm a practicing doctor at MedWell, located in Midland Park, New Jersey. I'm also the author of this book, How to Live Pain-Free and Happy, drug-free, non-invasive, non-chemical, non-surgical steps for resolving chronic conditions, chronic neck or back pain, neuropathy, numbness, tingling, funny sensations, headaches, thyroid, diabetes, low energy, insomnia. I consult with over 100 doctors nationwide with functional medicine, functional neurology, and functional endocrinology to help and fix you, the patient. Our goal is not to leave any stones left unturned with diagnosing what is the true cause of your symptoms, which in most cases is not what you have been told. Throughout the day, I get hundreds of emails and questions, and many questions are the same. So I'm making this series of videos to answer your questions and how to reverse your condition that you're taking medication for and you still feel horrible and you're not addressing the cause. A question that I need to answer to clarify and get often asked is the following. So the question is, why you still feel horrible but your lab tests are normal? And then you go to a doctor, you go to one doctor, they give you one medication. You go to another doctor, they give you another medication. The medication don't work, you take another medication. You see an advertisement on TV about a new medication, you take that medication, and you're still feeling horrible. There are a lot of reasons behind that. Reason number one is when you go to a doctor, they treat you with what they specialize at, and they look at your symptoms. What I mean by that, that's good for acute conditions, but for chronic conditions, it's not good, because if you have, for example, diabetes, every cell in your body gets affected by it. If you have a thyroid, every cell in your body gets affected by it. If you have a thyroid condition. So what the problem is, problem number one is that when you go to a doctor, the doctor looks at your symptoms. They don't look at your whole body. So you have to look at your whole body. Number two, the test that is ordered is the wrong test. What I mean by that is, for example, if you want to see if you're gluten sensitive for thyroid problem, diabetes problem, fibromyalgia, chronic fatigue, can't sleep, having low energy, there is a very likely chance that you're gluten sensitive. Now, you will not know it. You don't say, okay, I eat bread and pasta, I feel good. The only way to get the answer is to get tested. And what happens if you do a blood test doesn't show properly if you're gluten sensitive or not. You have to do another test, okay? So the test is very important if it's done, a proper test for a proper problem, okay? The next issue is when you do a blood test, in the blood test there is a range that's given by the lab company, that's called the normal range, and there is a functional range. The normal range is like this, the functional range is a lot narrower. So what happens, for example, when you get your blood test results, this is normal, this is abnormal high, abnormal low. This is the borderline. No good. A lot of physiologic problems, you see, the problems that you're having, lack of sleep, lack of energy, fatigue all day, thyroid problem, diabetes, those are all functional problems. So what happens, we have to look at functional ranges. Functional ranges, they're a lot narrower than normal ranges given by the labs. We have to see functional low, or functional within normal limits, or functional high. So tests are really important to be done, diagnostic studies. The proper diagnostic studies is more important to be done, and more important than that A person who is experienced with functional neurology, functional endocrinology, and functional medicine read this test results, and based on their experience, giving you the supplements, the structural treatment, the neurological treatment, and the metabolic treatment, all combined as one treatment regimen. I hope this helps. Our passion is to redefine and redesign your health with proper diagnostic studies and helping you naturally. I have published multiple DVDs about different chronic conditions. Secrets to neuropathy and restless legs. Chronic fatigue and fibromyalgia. Why do you suffer from chronic fatigue and fibromyalgia? Debilitating migraine headaches. How to get rid of your migraine headaches so you don't have a few migraine headaches every week. Medical breakthrough for diabetes. Why do you have diabetes? Why the treatment that you do, it doesn't even work now? Why you're taking metformin and taking medication, and why you have to take the medication for the rest of your life if you're following the same treatment regimen, and how you can get rid of it naturally. Thyroid, autoimmune, Hashimoto's, thyroiditis. A lot of female patients, they suffer with this. They take medication, Synthroid, synthetic drug, for the rest of your life. If you want to get off it, watch this DVD. I'm not telling you to get off any medication without a consult with your doctor. I just want to give you the information that is available. My last 10 years of latest research, how to get rid of thyroid naturally. Why do you feel like this? That's the title of this DVD. Why do you feel the way you feel? Why you're fatigued all the time? Why you can't sleep? Why you have low energy? Why you have been diagnosed with rheumatoid arthritis, Hashimoto's? Why you're diagnosed with Sjogren's disease? Why do we do neurological based therapies? Why do we do brain-based therapy? What's oxygen treatment? How it's going to help you neurologically? And last but not least, my method for posture correction. Permanent posture correction. Let me repeat. Permanent posture correction works on adults, elderly, athletes, and children from 1 year old to 95 years old. Results appear before you leave the office on your first visit. So these are not actually DVDs only. This is my life's work. You will get the fast track version. At MedWell, we are a panel of doctors and physical therapists working together at one location. We help people to live a better life with their family and friends. What makes us unique is that we diagnose and treat you structurally, neurologically, and metabolically. Why? Because most chronic conditions, most chronic symptoms need to be addressed and treated structurally, neurologically, and metabolically. We have helped thousands of patients like you with families like yours by addressing the cause of their problem. The reason you are not better is because you are not taking care of your condition, you are not addressing the true cause of your problem, or you're taking pills that you have been taking for several years and you will be taking until you're alive without realizing the side effects of them. We help you to find the true cause of your condition with a series of specific diagnostic testing based on your needs. If you have any questions, call our office for a same-day consultation. That is, if you want to get rid of your symptoms and your condition. If I accept you as a patient, you will need to work with me to get better with our natural and drug-free approach. You will also get a copy of my book, or the DVD based on your symptoms and your needs as my gift to you. I will look forward to see you in the future. You can call us at 201-848-8000. Yes, we accept most insurance plans, and God bless you and your whole family.